So let's talk about prep recommendations. I was on the SPEAR website, and I saw this photo by Bob Winter, and he talked about the prep on the first molar. It's prep for an Emax crown, and on the one behind it, it's basically the prep necessary for a zirconia crown. And you can really see here the difference in the necessary amount of reduction that you need in some of these areas. Since this was done, I believe Emax has come out and let everybody realize that you can prep down and use 1 millimeter bonded across the board on their restorations, but when you're talking about trying to cement a restoration, you cannot cement a restoration with only 1 millimeter of reduction and a 1 millimeter of material thickness. So we really get an advantage when we're looking to be a little bit more conservative in our preps to be able to cement these in this way. So you're looking for 1 to 1 millimeter to 1.5 millimeters of reduction through the central fissure. So that's really important for that proper thickness, so we can get that occlusal load and not fracture these. We have 1.1 to 1.5 millimeters of reduction over those functional cusps. You're going to have 0.8 millimeter chamfer margin is what we're looking for, and you're looking for about a 6 to 8 degree taper of your axial walls. Now I'll say that the incidence of debonding on zirconia restorations can be a little higher because I believe that people who do these chairside restorations and their bonding tend to sort of angulate those walls a little bit, so that taper is more in the 15 to 20 degree range, and you're certainly not going to get as much resistance and retention form when you're cementing. So if you plan on cementing, just be aware of the angulation of your walls, of those axial walls, to try to have some good retention, and you want your 3 millimeters of ferrule to really improve the lifetime that's going to be bonded on there. I also get some questions about retraction and hemostasis when we're prepping. So what I tend to do in my office the most is I tend to use retraction cord, and then I'll use anything that doesn't have the iron, the ferric-based aspect of the ingredients, because that's going to a lot of times stain your margin. So I like to use anything that has the aluminum ingredients in it. So I use Viscostat Clear when I want to soak some cord and pack it into a sulcus to try to pull that tissue away. What I like to use a lot is one of my favorite things that I have in regards to hemostasis is 3M retraction paste. I love the little compule that it comes in, and that small little needle nose tip that's on there allows me to get that 3M retraction paste pretty much anywhere I want and stops bleeding very quickly. A lot of times what I'll find is that when I do my preparations in my practice, I'll throw some 3M retraction paste in the prep. I'll use a Compra cap, which you can see below on that retraction paste, and I just have the patient bite down on it while I run and do a hygiene exam or something like that. And by the time I come back, you'll see here in a little bit, the tissue looks magnificent. And you can even pack a cord into that. Sometimes I'll even throw some 3M retraction paste and pack a cord around there, and then just come on back. And then if you pull that cord, you'll see how beautiful that tissue looks. So here's a case that I did in my practice where I placed in that 3M retraction paste, and then the cord was packed into that. You can see on the lingual that I have the cord sort of sticking out of the lingual there, so I can pull it in a bit. And I just had the patient bite on a Compra cap to sort of smoosh that down a little bit for me and allow it to help with a little compression. And then when I rinse it, the other thing I love about the retraction paste is it rinses so wonderfully. So you can see here, it rinses so nice off of the prep on this case. And I just grab that little tab, and you'll be able to see how nicely the margins look on this to be able to take your images, whether you're going to be scanning it for the lab or you're going to be doing it chairside. Either you or your lab tech will have an easy time trying to find these margins when you can see tissue that looks like that. So I'm a big fan of using those types of methods to get me this type of retraction.